Yeah, thank you very much. We know that malaria is a seasonal disease. It takes place during the rainy season when it rains, stagnant water. That's where the mosquitoes tend to breed and lay their eggs, and they will then bite people, the female Anopheles mosquitoes that carry the parasite called the Plasmodium parasite that causes malaria. Now, we have seen that since December, when we started to see an upswing in the number of cases, it has been observed that a number of cases have been imported from elsewhere. When we talk about a local case, it's a case where the mosquito-borne infection occurs within the borders of Namibia, while an imported case is where a mosquito-borne infection occurs elsewhere, outside the borders of Namibia. And we know this because our tracking tools and the statistic gathering systems provide for the persons who are coming to our health facilities to indicate where they were when the symptoms started. So that allows for us to indicate whether or to determine whether a case is a local case or is an imported case. Now, by the 19th of January 2025, we reported 5,898 confirmed cases in Namibia. There were 840 people admitted in health facilities. We have recorded, unfortunately, 28 deaths due to malaria. Now, in terms of how the imported cases impact our response, we know that of the total cases that I just mentioned, 3,493 or 58% are local cases, while 1,455 or 42% are reported to be imported. So, yes, imported cases would mean that there is more demand on our resources, there is more demand on our systems, there is more demand on our human resources to take care of these patients. It means, for example, if people have to be admitted, more bed space is taken up by cases that are imported. So it has an impact in terms of how the response is unfolding. And this is particularly true for districts like Eenhana, Okongo, and Engela, where the highest number of imported cases have been reported.
What other preventative measures are being implemented by the Ministry of Health to reduce mosquito populations and educate the public about malaria prevention?
Yeah, as I said before, in December 2024, we reported that there was an outbreak of malaria in the country. And as a result of that, the ministry did initiate public health measures in order to address the outbreak. Now, some of the activities include, intensified vector control activities. This basically means that we started to intensify the control activities such as reactive indoor residual spraying, because your normal annual indoor residual spraying, which is a method used to reduce the mosquito populations, for last year we started in August in Corihas. That's where we launched it. It concluded officially in December, around the second week or so. But because of the outbreak, we started what we call reactive indoor residual spraying, or some mop-up operations of the identified communities where the disease was spreading, just to go in there and again spray structures to reduce the population. We have also looked at issues of surveillance and case management. Surveillance basically means we need to find all the cases, all people who are ill. We want to know where they are so that they can be treated, so that we can even do contact tracing, so that we can also engage in case management, meaning that the people who are coming to the health facilities get tested and confirmed for malaria, and once confirmed for malaria, they are placed on treatment immediately. We have the pharmaceuticals to treat them. We have the testing kits, including the rapid test kits that are used at even a clinic level. A person will be able to get tested and then placed on treatment. And then case management basically means that our healthcare professionals will then treat those that come to the health facilities. Other measures include risk communication and community engagement. This basically involves door-to-door community education, so that our healthcare workers, our community health workers in the communities are educating members of the public about the symptoms, telling them what the symptoms are, encouraging them to seek healthcare early, because we are saying any person that comes down with symptoms that are consistent with malaria, that is, for example, a person has got fever, they've got muscle and joint pain, they have got nausea and vomiting, they have got headaches. If you have those symptoms, please go to the nearest health facility so that you can be tested. There is a term that is used in the health setting, that is to say the healthcare workers are operating what is known as a high index of suspicion. That just means that if you go to a hospital and you are displaying these symptoms, the first thing that the healthcare workers will check, particularly in the endemic areas, is whether you are positive for malaria, and then you can be placed on treatment. And this is not only true for malaria endemic areas in northeastern and northern and northwestern Namibia, but even in other parts of the country, because, for example, with now the holiday season having ended, people traveling from different parts of the country to other parts of the country, it's possible that a person who may still be in an incubation period when they were bitten by the mosquito would find themselves in an area that is not necessarily endemic to malaria, but because they went there already carrying the parasite, they could still be diagnosed with malaria. So this education must necessarily also reach all parts of the country, so that everybody who displays or experiences these symptoms gets the proper diagnosis, the appropriate diagnosis, and appropriate treatment. We are engaging with other stakeholders, for example, the Office of the Prime Minister, other offices, ministries and agencies, in order to assist us with resources, whether it is vehicles, whether it is the tents, etc., to be able to use these resources to prosecute the malaria response effectively.